Friday the 13th, time for another legislative update. It's graduation day for some, it's budget provisions day for others, but for everyone, it is the last day that you could possibly register or change your registration for the June 7th election here in North Carolina. So if you haven't gotten your stuff all squared away, if you need to do something to make sure that you can vote for your congressional person on June 7th, make sure that you get that done before 5 o'clock today, or else you won't have the opportunity to do that. For those of you that have already registered, already have everything squared away, we're into early voting season, so you can be doing that at your local Board of Election site. You can be requesting an absentee ballot if you're not going to be around on June the 7th and get that mailed back in, or you can be looking for the information on who you're going to be voting for in preparation for June 7th. Wherever you are in that process, we hope that you are engaged, we hope that you're getting ready for it and going to participate on June 7th. This week down at the legislature, we've been dealing mostly with the budget. The House is leading off this year with the budget, so the governor sent his budget adjustments over. The House has now been evaluating their budget adjustments that they would like to make in the second year of the biennium. We've seen different drafts and different ideas of what's going on there, but the provisions are just now all coming together, and Monday or Tuesday is when you're going to see the House really taking that up and going through the entire budget proposal, and we'll have a better picture of exactly what's happening next week. But a couple things that can be deduced from everything that's been going on. Medicaid is well below budget for the first year, so there's going to be some savings that can be translated into investments in other places of the budget as a result of that. And we're definitely going to see investments in mental health in this upcoming budget. So it's something that the governor recommended, it's something that the House is going to recommend, and I would suspect that it's something that the Senate will carry forward as well. So we're going to see some new investments in mental health care services and eligibility in the coming year. Also, we've seen the naloxone bill, the statewide standing order for an opioid antagonist bill, pass the Senate Judiciary 1 Committee. So that bill is now going to the floor of the Senate for an up or down vote on second and third reading. And we've also seen a number of discussions going on around other health care issues, whether it's funding for different health care issues, whether it's been visits by psychiatrists from all of the major institutions of learning around the state this week, but we've seen a lot of just buzz around healthcare and what we're looking to do with Medicaid reform, the opportunities around Medicaid reform, Medicaid expansion, and whether doctors want that for their patients, as well as different things around GME, funding, and other budget provisions. So we look forward to bringing you a more comprehensive update next week about the budget, exactly what's in there and what's not, how it compares to the governor's budget, and then start to forecast what we would hope the Senate would bring out as well. So until then, have a great weekend. Make sure that you're all squared away for June 7th, and we'll see you next week.